Assalamu alaikum wa rahmatullahi wa barakatuh. So why is infection prevention and control so important? The goal of an infection prevention and control is to provide a safe working environment that prevents the transmission of disease to patients and the healthcare worker. So the question is, how can we as healthcare workers prevent and control the spread of illness or disease while we treat and care for our patients? Well, the best way to prevent and control infection is by understanding the basics of infection control. Standard precautions and transmission-based precautions comprise the basics of infection control. Before we discuss these things, we had better make sure we fully understand how illness and disease spread in the first place. Illness and disease are spread by a series of 6 parts. These parts are called the chain of infection. Illness and disease cannot spread if any part of this chain becomes broken. That is the role of each and every healthcare worker to help break this chain. The first part of the chain is the infectious agent, which is any microorganism such as HIV, coronavirus, cold or flu virus or bacteria. The second part of the chain is the reservoir. The reservoir can be a person, an animal, or anything from the environment. The third part of the chain is the port of exit. This is the way in which the infectious agent will leave the reservoir. The portal of exit can be through saliva, feces, blood, or mucus discharge from the nose, eyes, mouth, or throat. The fourth part of the chain of infection is the mode of transmission. The spread of the infectious agent can either be direct or indirect. Direct transmission requires close contact with the infected host, but not necessarily physical contact. Indirect transmission requires a vector, such as an animal or an insect. The fifth part of the chain is the portal of entry. The infectious agent can gain entrance to a new host in one of 3 ways: penetration, inhalation, or ingestion. The level and severity of the infection may depend on the depth of penetration. The sixth and final part of the chain of infection is the susceptible host. This means the person has no immunity or defense against the illness or disease that they have been infected with. As an example, with the common cold, the reservoir might be a healthcare worker like ourselves. Many times, because we are exposed to many sick patients, we carry the microorganism on our hands and things we work with. If we happen to sneeze or cough and we neglect to cover our sneeze properly, or if we do not use a tissue to contain the sneeze or wash our hands properly, the virus will be spread to another person. It isn't just patients and co-workers we put at risk through neglect. Our families and loved ones are also endangered. This is why it is so important to know the chain of infection, to make sure that we are not contributing to the spread of disease.